Docusate is classified as a stool softener. It is used for constipation and to prevent straining during defecation, especially in high-risk patients like those who just had surgery or a heart attack. Talking about the mechanism of action of Docusate, it belongs to the stool softener class of drugs. It reduces the surface tension of the oil and water interface within the stool, facilitating the passage of water and lipids into the stool mass. This medication works by surfactant action, which decreases surface tension between water outside stool and the fat in stool. The water penetrates stool, mixes with fecal matter, creating softer formed stool. If we talk about clinical indications or use of Docusate, it is used as a laxative for treatment and managing constipation. It is preferred when straining should be avoided, like in postpartum, post-myocardial infarction, anal fissures, hemorrhoids. Docusate sodium is sometimes used as a ceruminolytic agent to help remove earwax. Docusate sodium is a water-based agent that helps hydrate and break down earwax, making cerumen removal easier and more effective. Side effects of Docusate are generally mild. Anorexia, diarrhea, and vomiting are usually associated with excess doses of Docusate medication. Some people may experience abdominal cramping or rarely develop a rash as adverse reaction to Docusate. Talking about contraindications and precautions, Docusate should never be given if there is a gastrointestinal obstruction or abdominal pain of unknown origin. Never give oral Docusate along with mineral oil because it increases risk of systemic mineral oil absorption, leading to inflammation of the intestinal mucosa, liver, and spleen. So that was all about clinical pharmacology of Docusate. Hope you like this video. For more pharmacology pearls, keep sharing and keep supporting us. Thank you.